Good morning. Thank you for joining us today. This is the Disability and Aging Community Living Advisory Committee, or DACLAC, DACLAC. So we appreciate all our attendees as they're logging on and getting settled. We will go ahead and go over some logistical information. I am Carol DeAndres. I am the MPA Stakeholder Engagement, the Master Plan for Aging, MPA Stakeholder Engagement Manager here at the California Department of Aging. Thanks for joining us. This is our webinar for the DACLAC meeting. We welcome you to the first Disability and Aging Community Living Advisory Committee, or DACLAC, DACLAC meeting for the first meeting for 2025. Today is March 6th, 2025, and just going to go over a few logistics. We have closed captioning available to you. You may select that via your Zoom toolbar under CC, and if you don't see it, a lot of times it's under those three dots more. We also have ASL available, and so we thank Rex and Bailey for being with us today to help with our ASL interpretation. The meeting slides, transcripts, and recording will be posted to the CalHHS webpage following this meeting. And committee members, our DACLAC committee members, if you've yet to do so, can you please rename yourself to your name? Right now it has a generic DACLAC member and panelist. So we'd like to know who's joined us today. Next slide. Couple other logistics is the chat function is enabled for committee members, California Department of Aging staff, state staff, and guests to share out meeting-related resources and information. And the public is able to view that content shared in the chat. The chat and the question and answer functions are not enabled for comments from public attendees, but we do invite you to participate in the public comment period. There are two in this meeting. And as always, so we ask you to hold your public comments at that time. But as always, you may submit your written comments anytime to our Engage email box, which is engage, ENGAGE, at aging.ca.gov. Next slide. Couple logistics with regard to how our public comment moves forward. Attendees joining by phone, you can press *9. That will indicate to us you would like your line unmuted. And attendees joining by the Zoom webinar function, there is a raised hand icon, which will also indicate us to unmute your line. We ask 2 minutes for your public comments so that we have time to make sure that we're able to get to everyone who wishes to give a comment. And again, at any time, you may submit your written comment to our Engage email box, ENGAGE, at aging.ca.gov. Next slide. The purpose of the DACLAC committee, the purpose of the Disability and Aging Community Living Advisory Committee, DACLAC, is to advance community living, inclusion, and integration across California. DACLAC ensures the involvement of individuals with physical and intellectual disabilities, older adults, and/or other partners who provide services or represent consumers. DACLAC advises the California Health and Human Services, or CalHHS agency, in addition to other state entities, on community living policies and programs, including but not limited to long-term services and supports, transportation, housing, and employment opportunities. This is the purpose of this committee. Next slide. And of course, we can't accomplish this purpose without our esteemed members. And here you will see our stakeholder co-chairs, our state co-chairs, and our stakeholder committee membership. And we are thankful to each and every one of you for sharing your time and your expertise to further the purpose of community living. And so at this time, I would like to turn it over to Susan DeMorris to give us our welcome. So,
Great. Thank you. Thank you so much, Carol. Good morning, everyone. Welcome, one and all. And without further ado, I'd like to yield my time to a special guest joining us today. I'm so grateful and honored that Secretary Johnson is joining our meeting today. This is an advisory body to the Health and Human Services Agency. Our first time having our secretary with us in this role, but Director Johnson at the Department of Social Services was a longtime member, contributor, and participant in the DACLAC, and before that, the Olmsted Advisory Committee. Secretary Johnson, thank you very much for joining us this morning.
Thank you, Director Morris. It is a pleasure to be with the DACLAC and community, in community with all of you this morning in this new capacity. So appreciate again you coming to this space, really both demonstrating the additional needs and gaps we need to fill for these communities across California, and also celebrate our progress as well. So just thank you for being here and engaged with us in this work. I want to also welcome not a new member to this group, but new in her capacity, new director of the Department of Rehabilitation, Kim Rutledge, to her first meeting in her new role and capacity. And Kim brings lived experience and deep state experience, first with the Department of Social Services and the In-Home Supportive Services Program, as well as at the Department of Rehabilitation. So Kim's just a tremendous advocate and champion for disability and aging, and she has long been associated with this committee, going back to the Olmsted days. Yet another table where Kim will demonstrate her leadership that is most welcome in this space. So welcome in this official capacity, Director Rutledge. Also joining Director Rutledge, as you likely know, we have officially Director Pete Cervinka at the Department of Developmental Services, as well as Director Troya at Social Services. So again, appreciating and recognizing some familiar faces to all of you, but in new capacities across state government. I also have the great privilege to celebrate and recognize Marty Amoto. Marty has just been a phenomenal and fierce champion and advocate in so many ways. He's currently the DACLAC subcommittee lead and has had a career of over 20 years of supporting and being a voice, an advocate, a champion for disability. At the end of this month, Marty will be leaving his post and his participation in the DACLAC, and want to give just some history for his participation. In 2004, Marty was appointed by Secretary Kim Shea at the time to serve on the first Olmsted Advisory Committee. Over the next 20 years, Marty would lead and advocate to ensure that people with disabilities have equal rights and opportunities, advocating for accessible environments and policies that allow them to live independently and make decisions affecting their lives. Marty has lived experience and has always been generous in sharing his lived experience with us, caring for his sister with intellectual developmental needs, and now his son, Alex, who recently became his own Social Security SSI payee, which is a very big deal for Marty and Alex. We are going to miss Marty tremendously, but we'll know that this next chapter, spending time with his family and friends, and especially his son, will be absolutely priceless. Marty, deep appreciation, not only for the passion and the, again, generosity of sharing with us your experiences along the way, but the how really matters in this work. We have had certainly ups and downs and challenges and successes. You always bring your heart to the work. You always bring accountability to government very clearly, but the partnership is just so greatly appreciated. I would love to give you just a moment to say anything you'd like to the group this morning.
I just want to thank you, Kim, Secretary Johnson, for those kind words. I was surprised when I had heard that you were going to, come here. And also make mention of my departure after 20 years, and it means a lot. The other coincidence, of course, I was appointed by Secretary Kim, and now I'm leaving with the Secretary Kim. Maybe I was waiting for that moment. But I just want to say thank you so much to everyone and to all my colleagues. I want to say quickly, my older sister Elena died in 2003. I was speaking a week before that. I was speaking at a rally in Modesto against cuts, and after the rally, there was about 100 people there. This woman came up to me and she had tears in her eyes, and she said, "You know, I wasn't going to come here today." And I said, "Why?" She said, "My daughter died. She had mental illness, actually, and she had died. And I wasn't going to come here." And I hugged her and I said, "Well, why did you come?" And she said, "Because I don't want it to happen to someone else." That was less than 2 weeks before my sister died. And when my sister died, I felt like giving up, but I remembered her. And 2 years later, my younger sister died. She was 47, and she died of a heart condition. She had no healthcare coverage. And I felt like giving up then. And I remembered her, that woman, telling me that story. And literally it was just 2 weeks before the first Olmsted meeting in March 2005. And so I mention that is not because my situation was special or not different or extraordinary. It's that we all face those kinds of challenges. And I think the ultimate message for all of us on this committee and as advocates off this committee and in your work as state partners is that we cannot give up because we have no choice, but also because we cannot. And so I thank you for your words, and you and I are going to still be working together. Okay. So thank you.
Thank you so much, Marty. Your leadership has been just absolutely tremendous, and we just appreciate you so much. And you are leaving a legacy for others to model how to get things done in the state of California. So thank you so much. Greatly appreciate it. Thank you. I also want to recognize the tremendous devastation that has occurred in Los Angeles. And throughout the months and the fires that have occurred, and want to just both thank everyone who has been part of our ability to take what happened and identify what we can do to improve our responses moving forward, especially again for those that have disabilities and other access and functional needs, and also in the recovery. I myself have spent several weeks of this year in Los Angeles County, really working hand in hand with the community to better understand just that. Many of the directors across the California Health and Human Services have done the same, as well as their teams. We are invested in doing better, and we have more to do. So I want to just greatly appreciate, again, the continued space. I was able to meet with the Impact Committee and have some additional focused conversation as well on this from the Master Plan on Aging. And again, we have more work to do better by Californians in wildfire or any disaster response. So know that we are leaning into that and continuing to take steps, both again in the recovery of Los Angeles, but in our overall response efforts. I also want to name that 2025 has been quite active, and obviously with the federal transition, many rapid changes happening at the federal level. I want to just say to each and every person on this call, our commitment at the California Health and Human Services Agency holds steady. State non-discrimination laws remain in place. State programs remain critical to addressing disparities and fostering inclusion. And we remain committed to a healthy California for all. Our diversity is our strength as Californians. We will absolutely continue to work together, firm in our commitment. And just want to appreciate that there has been many, again, a lot of actions, some uncertainties in terms of the ability for some of those actions to be implemented. We are, of course, working very closely and engaged in those conversations. And as we have firm proposals and things that we see happening, we will absolutely be engaging to continue to work together to continue and maintain our progress in California. So naming that has taken a lot of space in 2025. I also just want to indicate that we have another master plan to celebrate that will be released this month, and that is the master plan for developmental services, which again emphasizes the whole of government approach. DACLAC is an outstanding example of multiple state agencies and departments joining together to break down silos, whether it's healthcare, housing, or transportation. You are a model in state government where communities lead in partnership with the state government. And so we recognize that this stakeholder series of recommendations will come forward. We will be working to implement and again, looking for those opportunities of intersection across, again, the Master Plan on Aging and other efforts, behavioral health. We have a lot happening with Proposition 1, et cetera. But want to just again say to you all who are taking the time, your precious time to engage with us in this space, we greatly appreciate and value the recommendations that you are putting forward. Everything is on its own kind of path in terms of what we can immediately implement or what we need to think about moving forward. And sometimes we certainly have to prioritize those things, but we want to go together. And as the African proverb says, you can go fast alone or further together. We want to go further together, but also recognize the urgency and need in communities. So just thank you for being the example of the cross-cutting integration that we are trying to achieve. And we will be working more with you ahead. So thank you all for being here, for being a part of this, and looking forward to continued engagement along the way. Have a great day.
Thank you so much, Secretary, for being with us today. And we will report to you after the meeting. And now I'd love to turn the agenda over to my state co-chair. It is an absolute joy to welcome my colleague Kim Rutledge to her first DACLAC meeting in this capacity. Welcome.
Thank you so much, Director DeMorris, and good morning, everyone. I'm Kim Rutledge. Been director of the Department of Rehabilitation for a little over a month now. And before I get into my own remarks, I'm just going to take a half of a step back and pile on to the love for Marty Emoto on this occasion of being his last DACLAC meeting. He was probably at my first ever Olmsted meeting, probably 15 or so years ago, and is everywhere I have expected him to be for as long as I've known him. He is, you know, in my soul, a giant in our community and everything that an advocate should be, and also someone who I have learned so much about. We've said lots of things about Marty in meetings, but Marty's emails are the most invaluable thing. I learn something sometimes about things I'm working on myself from the reports that he sends out. And they all go in a folder, and I often go back and reference them later, and I've been doing that for so many years. And I have learned so much from you, Marty, and just value your thinking and your ideas and your advocacy and your friendship and support. And so even though you're not going to be at this table anymore, I just want to express my appreciation and hope that you're not really going anywhere. So thank you, and thank you for giving me a chance to just give Marty a little shout out. So I'm not going to take up too much of anyone's time this morning because we have a very full agenda, but as the new co-chair of this committee, first of all, it's such an honor. As I mentioned, I have been coming to these meetings since it was the Olmsted Committee on the second floor of DOR many, many years ago, and I've really watched this committee evolve and grow over the years. And so for me, being here now in this role and as the co-chair feels in some ways very full circle in my own career. I want to thank Secretary Johnson and also Director DeMorris for their support and of this committee and of me personally as I step into my new role. And I'm really looking forward to bringing the disability perspective to this important committee. I think that I'm really excited to engage in this work because it really ties to my mission as the new director of DOR. I think that oftentimes people think of the Department of Rehabilitation as being first and foremost an employment program, and we are, and we're very proud of the work that we do every day to get Californians with disabilities into competitive integrated employment. But community living is the critical piece to employment. And because someone cannot go to a job unless they have a house. For many of us with disabilities, we can't do our jobs without adaptive technology, without the assistance of personal care assistants. All of these different things, all of these things that allow us to be able to live in the community also allows people with disabilities to be able to work in the community. And so I'm really excited to be able to dig into this work with you all to really strengthen our mission of making sure that individuals with disabilities can thrive in their communities and truly live in their communities. I'm also really excited again to be able to partner with Director DeMorris and her fantastic team at CDA to really bridge the aging and disability communities even more. As people with disabilities live longer, especially in the IDD community, but also people with physical disabilities. As we age longer, the aging issues and that intersection between aging and disability is going to become more important and more salient all the time. So it is just really an honor for me to be able to be a part of this committee. I'm really excited to dig into the work and understanding that we are in a very, very complex time in our state and in our nation right now. The work that we do here as a committee is more important than ever, and I'm excited to get right into it. And so with that, I am going to pass the presentation off to Hagar Dickman from Justice and Aging to give a presentation on some perspectives from the committee.
Thank you so much, Director Rutledge, and also Secretary Johnson for your comments. I wanted to start us off really building on what Secretary Johnson had started us off with as well, really recognizing the work that we do here at DACLAC. The purpose of this advisory committee is to convene disability and aging advocates and stakeholders and state partners to work together to ensure that older adults and people with disabilities have the supports they need to live in integrated community settings. And it's through this work that we as a state have made so much progress in expanding and improving services, especially through the work of the Master Plan for Aging. And I wanted to take a minute and uplift that and give a space to recognize all of that work that and the progress that we've made through our work together. I think it's not lost on any of us how important Medi-Cal is to achieving our goals. Our state partners and stakeholders, many of whom are on this call today, have done tremendous work over the years to expand who is covered and what services are available. And the innovation, expansion, and overall success of our Medi-Cal home and community-based programs is a testament to the dedication of California advocates and our state partners to ensure that everyone who needs services has them. The work isn't done yet. There's plenty more to do, as you'll hear from our stakeholder groups soon. But I wanted to at least start us off by calling attention to how far we've come as a state. The federal threats to Medicaid are really a threat to Californians and to all that progress that we've made in our state to support community living for all our residents. So our effort now turns not only to improving our programs, but to defending them by opposing all cuts that will impact the services that we know are integral to supporting older adults and people with disabilities, whether those are Medicaid cuts, cuts to housing services, or cuts that impact economic security like SSI and Social Security. As the state's advisory committee on community living, we have an obligation to each do our part to communicate to our representatives in the federal government how important Medi-Cal is to all Californians. And you can do that by calling your representatives, but also by helping our effort in collecting stories of consumers and people with lived experience who can tell their representatives the role that Medi-Cal plays in the health and well-being of older adults and people with disabilities in the state. I wanted to turn it over now to the committee to discuss both ideas and around that kind of advocacy and places where we can all come together and work to really step up and work both with state partners and with our various stakeholder groups to make progress on this effort. So I just wanted to just turn that over now to the committee and see if you have any comments or thoughts.
Well, Hagar, this is Sherry. I think everybody's being a little shy this morning or needing to grab another cup of coffee, but I know that we all have thoughts and reactions, concerns about the proposed drastic cuts that might be coming down to Medicaid services. So I just wanted to say I really appreciate the work that so many organizations have been doing, Justice and Aging certainly being one of them. And getting the word out, educating the public about how much Medicaid, and obviously in the state we call it Medi-Cal, but how much is covered under this program, and how much we rely on our partners at the federal government to assist us with providing basic health care and home and community-based services, so people are able to stay in their homes safely and independently with the supports that they need and avoid homelessness or institutionalization. And these are such vital programs and services. And I hope that we all can work very closely together in educating our friends and family and community, including our constituents that we serve, to let them know how important these services are and what they can do in order to let their congressional representatives know that, their own personal stories for themselves and family members and friends, so that they know how vital these programs are. I'm seeing hands now, so I'll let you go ahead and call on. It looks like Michelle had her hand up first, so I will mute myself. Thanks, Sagar.
Yeah, thank you, Sherry. It's Michelle Rousey. I hope you can hear me. All the talk of cuts and not just the Medicaid program, which is Medi-Cal in the state of California, but all the cuts potentially harming our seniors and people with disabilities and everybody. It's not just coming down of cuts to our social services, but just the threat of cuts elsewhere to our incomes and everything else, I think has everybody in a state of shock. That it's like everything is being thrown into the pot and seeing what will stick and what won't for us cuts. And honestly, it's put a fear in a lot of us. And I know with me, it's just put a general fear of not only losing my home care and other Medicaid programs, but also my housing and other things that I need to be able to live in the community. So, I really do appreciate what the state's been doing in our different programs and reaching out to people and educating them and things like this. But more needs to be done. More needs to be done so that our federal partners understand the devastation that will happen when these programs are cut. So thank you.
Thank you, Michelle. Carolyn Nava. Hi, Carolyn.
Morning, Hagar. Good morning, everyone. We have been hot topic on this point. I just came from the Older Adults Policy Council meeting in Shasta County. We spent 2 hours discussing this very topic this morning, our concerns. We are definitely being hit heavily. And what we are finding in our region is that those that are the most affected, once again, are the most vulnerable cross sections of our population. Our veterans are being hit heavily with these cuts. You wouldn't imagine that that's the case, but we now have veterans who are facing homelessness in our region because they worked for programs that have now been cut. They're jobless. So the repercussions of these actions, we're now asking, what will it take for that awareness to be raised to understand we're hurting the very people that we vowed to protect. So we have our seniors and housing again being hit hard, our veterans being hit hard, our tribal coalitions in our regions, funding's cut seriously across the board, funding's cut, affecting the tribal elders, the most vulnerable again in all cross sections of our population. We're ready to pick up the signs. We really are. So here we go.
Thank you, Carolyn. Janie?
Thank you. Yeah, I echo what everybody is saying. I am the president of SECA, California IHSS Consumer Alliance. I know that you all know IHSS is such a huge program across our state. We currently have about 850,000 people on IHSS, and they are very, very vulnerable at this point. And I look at our population that not only that you have to be Medicaid eligible to be on IHSS and have Medi-Cal. So not only are they looking at their home care providers, but they're also looking at their food, availability of food, their availability of their homes, their availability of practically everything that they get. And they are frightened. We are reaching out to our folks now, trying to get them and educating them and teaching them how to be advocates for their own needs and reaching out to their legislators. And we are particularly trying to reach out to those 4 counties where we have the Republican legislators to get them to understand how important this is, especially in their counties, because they have such a high population of folks that utilize Medi-Cal. I ask all of you on the call today to reach out to your folks and to ask them to please advocate for themselves, to reach out to their legislators and say, stop. This is going to hurt me desperately. So thank you.
Sorry, I'm trying to see who else is. Marty, you have your hand up.
Thank you. Marty Emoto, dad, family member, City Can. First of all, Gar, thank you for raising these issues, for this committee meeting. And I really think it's going to be important in future meetings that this be a center topic because this threat, these problems are not going to go away in the next 2 years, if that. I do want to say the importance that we need to do as advocates and also with our state partners is to really making sure that good information is put out to our communities, to the people in California, because nothing is worse than to spread panic and fear when people are reacting to something that may or may not be true. The problem is, how do we translate what's being proposed in Washington into what could happen to an individual or to their families or the people who provide services? That's not easy, because what happens in Washington, and I'm not saying anything you don't know, or for a lot of people on this meeting that they don't know, but terms are used that are meant to confuse. So no cuts to Medicaid, Medicare, or Social Security, except for waste, fraud, and abuse. And I want to make sure that we put names when they say that, when they make a cut to my son Alex, or to Michelle, or to a person who provides services. We need to make them define what is waste, fraud, and abuse. And that's not going to be easy. And so I think that's going to be a challenge to us, is how do we translate what is happening? And also, how do we translate the threat being made by certain government officials in Washington versus what is actually passed or implemented? And then what is a cut, for instance, to Social Security that they're talking about, of reducing the employees by half? that doesn't sound like it impacts my son or anybody else who is connected to the need for disability, these types of benefits. But in fact, it can. You know, what does it mean when you reduce funding or try to eliminate the entire Department of Education and the impact to people, to families who need special education, early start? And I just think it is Medicaid, it's all these major programs that ultimately are linked back to individual lives. And, you know, there's a lot of fear in our communities that is quite justified. And so I think to everyone's point, to Carolyn, to Hagar, you made the point, we have to make sure, and Janie, we got to make sure that we mobilize and respond smart and effectively, and knowing that we can't give up. So that's just my point. And I want to thank you, Justice Aging and Hagar, for for really getting the word out, and for our other partners as well. By the way, we have to work with our state partners, with the legislature. What can we do here in California to actually respond in the best way possible? So thank you.
Thank you, Marty. Jeannie, do you want to go next?
Yeah, thank you, Hagar, and thanks for highlighting the issues that we're all addressing today. And thank you also for Justice and Aging's leadership on these points. I'm Jeannie Parker Martin, the president and CEO of Leading Age California. I also am a member of the California Commission on Aging and also an original member of the governor's Master Plan for Aging Stakeholder Advisory Committee. And in that role, the last role, the Master Plan for Aging Stakeholder Advisory Committee, although it did sunset technically, a group of stakeholders have continued to meet, and somewhat of an expanded group of stakeholders. We meet monthly to discuss just these very types of issues. And this afternoon, we're meeting to talk about the impact of Medicaid, and importantly, what some of the stories, as Marty has highlighted, are, who are the names behind those impacted by potential cuts, and also a call to action that we all must call our own representatives and those other representatives around the country at the federal level that might influence final decisions. Leading Age California serves affordable senior housing settings and other settings serving older adults across the state. And so we're very concerned about the impact of the potential cuts and are looking at innovative solutions, which I think all of us will have to pull together on opportunities to think differently, perhaps, about the way we receive and provide services across the state. So I'm looking forward to the rest of the DACLAC conversation today, and also how we might be able to be the most impactful to those that we all serve across the state of California, and also the so many others that are impacted, families and friends and relatives, in supporting those who are needing support at home and in other settings. So thank you.
Thank you, Jeannie. We're going to go to Jeff and then to Kathy Kelly.
Okay, thank you. I'm Jeff Tom, with the Deputy Director of Governmental Affairs of the California Council of the Blind, and I want to associate myself with all the prior comments, and I want to talk a little bit about something that's a little bit of a different spin on things, and that is, in my discussions with specifically agencies that provide services to people who are blind and low vision, a lot of the discussion has been around federal grantees and contractors who are being required to remove DEIA policies. And, you know, this is going to create issues even here in California. I think that as the basic conclusion of these agencies, that they want to continue doing what they are doing, but they may have to modify the language they use to do it, or take different approaches. So we're going to have to really look closely at these issues. I know of one contractor, for example, that their agency had a 508 compliance contract canceled since the administration took over. So we have to look very carefully at these issues and make sure they don't impact the culture that we have here in California and really throughout this country. Thank you.
Thank you, Jeff. I think Kathy is next.
Yeah. Hi, Kathy Kelly from Family Caregiver Alliance, and I'm representing the voices of the Caregiver Resource Center system and the unpaid family caregivers, family and friend caregivers that are providing services to individuals across the state as their long-term care provider. I agree and concur with all of the comments that are around the seemingly more diminished access to home and community-based services, of course. But I also want to communicate that it's kind of beyond, another step beyond that is access to basic kind of healthcare availability, particularly in rural areas, because this will hit rural hospitals very hard. And we've seen a lot of hospitals go under in the past few years, not just here in California, but also across the country. So the access to healthcare is going, I mean, I think we need to keep that in mind as well. I know that we're advocating directly for person-centered services, but access to healthcare is also kind of on the line as well. The other piece that we're watching and communicating back out to our clients too is the telehealth benefits and making sure that those remain for individuals that are caring for persons with dementia, which is about 75% of our population. Bringing individuals into healthcare settings for routine kinds of exams is very confusing, and it's oftentimes the reason why people don't get seen as frequently or have healthcare intervention as frequently as they want. So while we're talking about the more direct hit, there are other permutations of cuts that are coming down the road or being discussed now that have definite impact on not only the persons that need assistance and services, but also on their family systems as well.
Thank you so much, Kathy. We're going to have 3 more comments, and then we're going to open it up to public comment. We'll go with Debbie, then Megan, then Andrea.
Hi, everybody. This is Debbie Toth with Choice in Aging. I apologize. It's not for lack of trying, but I cannot fix whatever the camera issue is. So I apologize. I am here in human form. I'm also wearing a black and white checkered blazer, which nobody can see magically, and an off-white shirt, and I have long gray crazy hair. So I have so much to say, and I'm going to be brief, but a couple of things. One is I want to just say I don't always agree with everything our governor does in our state, but one thing he has gotten exceptionally correct beyond doing these master plans is the people that he has appointed to director positions and secretary positions. We are in an unprecedented time where we have remarkable leaders leading our state departments. And I want to recognize that you guys can't say everything you're thinking or feeling at any given time. I get that. But I want to implore you to lean into the reason that you were appointed to the position that you're in and continue to elevate the voices and the needs of the most marginalized in our community, particularly those at the intersection of multiple disabilities and other isms that we have in our society. We are going to rely on you to be our voice when you are in those back rooms. And we know, based on historic practices, that when we cut things for elders and people with disabilities. And California is going to have to really lean in to protect these populations in the coming years. And we are here. We are your tentacles out in the community, doing direct services, doing the advocacy work. And we need to figure out new and innovative ways to partner together so that what you're thinking and feeling and can't say out loud, we can express and deliver out in the community, in the legislative rooms, wherever that needs to happen. I also just want to give a shout out to Disability Rights California, Justice and Aging. I want to do what Jeff Tom did and just echo sentiments of everybody prior to me, and just thank everybody who's really stepping up and helping lead the way, because this is unprecedented. It's scary, and we're not going away. So thank you.
Thank you, Debbie. All right, Megan.
All right. Sorry, I think there's like, yes. So I don't know, it's not even a seconding everything everyone has said, but really appreciate this opportunity for this discussion and to, I mean, start with Medicaid and the concerns around potential cuts there, but then to hear from everyone where all these different decisions that are coming down and actions are impacting communities we care about, from all sides, right? I mean, people were mentioning housing and food and healthcare. And you know, we have this platform and a few others where we gather to be able to elevate these issues, but it's so important to hear from everybody. Like, I really valued hearing from Carolyn about what are they, you know, the veterans in her rural community are experiencing, and with Kathy with telehealth, like all these different things. And so where do we come together to identify, because things are moving so fast, like the different ways folks are being impacted, to be able to respond, and knowing that there is just so much coming at all of us. You know, how do we also kind of organize in a way where we identify that, like, you know what, this thing is your expertise and we're going to lean on you to tell us what's going on in the veterans area, and the telehealth, and the Medicaid, and the housing. You know, who's the people we can go to, I think, as a group to be like, hey, you know, what's happening here? I also, I think it's building on what Debbie is saying too, around just thinking about some of the communities that have that are historically marginalized, and making sure that we are, as we're trying to navigate these spaces and ensure that we can continue to progress forward in you know, in our Medicaid, and providing the supports needed to live in community, age well in community, making sure that we are tapping in and making sure that we are listening and creating space to hear from some of the different communities that we maybe don't hear from as clearly and as loudly. And so how do we amplify those voices and ensure that we're actually checking in? And then, you know, with all this, like thinking about all the things that could be coming down, are coming down, all the changes, wanting to acknowledge that, and I think Marty and a few others got to this, some of it's like, there's an executive order, this thing's going to change, but then does it really? So like, what's really happening versus what's not? And how do we manage that, but to continue as a state to look forward, that we have the master plan on aging and other master plans as these guides to be future forward. And so realistically, how do we defend, but also continue to focus on the things that align with our values and the goals that we have as a state? Just raising that up.
Thank you so much, Megan. We are going to go to Andrea, and then to Nina, and then to public comment.
So, hello, everybody. My name is Andrea Robert, and I'm a little choked up because I'm thinking about personally how I will be impacted in regards to the cut. I rely heavily on these services. I am a single parent. I'm not a single parent. My son is grown, but I live alone. I am single, and I am 59 years old, and I just recently started receiving a lot of supportive services and subsidies. My biggest concern is going through the recertification process, because once you get these services, you have to recertify every year. And my fear is that if they have the cuts, that it will impact in regards to your caseworker getting back to you, helping you process your paperwork and other vital things that you need. One thing that helps me is being on these committees because I get a chance to see firsthand the work that you guys are doing to advocate for people like myself. And when you're out champion for us, think about me, my pain, and my peers. A lot of my peers are receiving in-home supportive services and Medicaid. Medicaid pays for a lot of these programs. I get DRS, housing subsidies, and it would be a big impact for me. And it's scary. This is really scary, but again, I'm able to put perspective on it because I sit on these committees and I see what goes on and I see how hard you guys are working for us. I see how hard that I've advocated and helped people over the years. But I want you guys to understand this is serious business. This is going to affect a lot of different people. A lot of my peers are not on these calls. They don't get a chance to sit at these tables. So because I have this opportunity that I can share with them, which I always do, to let them know California is looking out for us. And not that they don't have to worry, but we're all out there at our own different ways trying to advocate for people like myself, people with disability. I am aging. I'll be 60 this year. And I just want you guys to know that you're dealing with real life people in their situation. And I thank you so much for all the work that you guys are doing. And I thank you for allowing me to sit on these committees and give my voice and tell my truth. So again, thank you.
Thank you so much, Andrea, for sharing and for speaking. And we'll go to Nina, and then I'll wrap things up here and we will move us to public comment.
So good morning, everybody. And Andrea, thank you for sharing your story. I actually want to go back to Carolyn's comment. It ties in completely with the HCBS gap analysis. One of the top findings, and not the top finding in there, was the lack of access in rural communities. And this is just going to get worse if Congress is successful in passing these ridiculous and devastating and heartless cuts. So I really just wanted to add on to what Carolyn stated, but everyone's going to suffer in some way, shape, or form, whether you're a family caregiver or you have a child in the DD system like I do, a grown adult child. But and thank you, DOR, for everything you've done for him too. But just really also just want to associate with all previous comments. Thank you.
Thank you, Nina. Before I move us to public comment, I just wanted to kind of sum up everything that we've just heard and just to highlight how impactful any kind of cuts to Medi-Cal and other services will be on our constituents here and on people in California. And just to remind us that the time right now is to fight Medicaid cuts and not to start making tough decisions before we have to. At the point at which the state is going to have to make tough decisions, I think we should go back to the comments made here today about California values, and make sure that we are considerate and thoughtful about the needs of all populations, so that people are, instead of pitting populations against each other. So the unity that we're seeing here today is something that I think personally we should really hold on to throughout this very difficult and long fight that we're going to have over the next few years. So with that, I'm going to pass it on to, I think, Carol, are you going to run public comment?
Yes. Hello. Let's go ahead and put up the public comment slide. Thank you for sticking with us. It's been a really illuminating conversation. This is our public comment period. For those our guests on the line, if you would like to give a public comment, if you're appearing by phone, press star 9. Attendees by the Zoom webinar can click their raised hand icon, and you will have 2 minutes to give your comment. I see we have one hand raised. I'm going to, this is area code 530, last digits 0297. So I'm going to unmute your line. You can go ahead. Can you hear us? Can you unmute your line?
Hi.
Great.
Hi there.
Great. Great. Go ahead,
This is
please.
Barbara. Hi, this is Barbara Hanna. I am part of the DACLAC committee, and I apologize.
Barbara.
I've been listening to everything. I want to just, I agree with everybody. One of the comments that I have is, as advocates for the poor and, you know, all of the other people that we represent, one of the things I've been thinking about is that the state is pushing hard and heavy, moving forward to having health plans take over many of the waiver programs. And I think we need to invite them to the table and help advocate with us and for us, because they're going to have power. They're getting the money for Medicaid given directly to them. And I want to see them at our table because we need to partner with them. And that's all I want to say.
Thank you, Barbara. Okay. Next up, we have Joseph Wilson. I'm going to unmute your line. Joseph, you may go ahead.
Hello, my name is Joseph Wilson. I'm a systems change advocate for an independent living center. Because I'm hearing a lot of people wondering what to do and who to talk to, or if there's any places to advocate. One thing I recommend is reaching out to your local independent living center, because we were doing a lot of like educating about these cuts and what it means for consumers, and also getting individuals connected to, like, you know, coalitions, and also helping people connect with their representatives to, you know, tell their stories. So if anybody's interested in advocating for or advocating like against these cuts, you know, that's a good place to start, because we can get you connected to the larger coalitions and make a bigger impact. That does it. Thank you.
Thank you, Joseph. We appreciate your comment. This is our public comment period time. If you would like to give a comment, please press star 9 if you're appearing by phone, or your raised hand icon on your Zoom will raise your hand. I see Cindy, you have raised your hand. Go ahead and unmute yourself, Cindy.
Okay, thank you very much. My name is Cindy Soto. I'm with the Independent Living Center in downtown Los Angeles. And I think that unfortunately the general public do not see us as uh they do not see us as giving to the community. They think we're all just pathetic, poor little waste, you know, laying around in bed watching TV. So we need to change the perception of who we really are. You know, we do work, we do have families, we do go out and volunteer our time. And so if we could change the narrative on who we really are, then I think that could be helpful. Thank you.
Thanks, Cindy. Appreciate your comment. Again, this is our public comment period. Feel free to use your raised hand icon or press *9. Of course, we will accept your comment at any time. Written comments to our Engage email box, engage, ENGAGE, at aging.ca.gov. So if after this meeting something comes to you, please feel free to reach out in that way. We will have another public comment period, so if you want to go ahead and feel free to share at that time as well. I am going to spotlight Hagar.
Am I speaking yet? I think we're going to break, right?
I think we are as well. Yes.
Everyone needs a break. All right.
Do we want to bring up the break slide?
Sure. I think actually I saw that Aaron had a comment, so I don't know if we have a moment to let Aaron speak.
Sure, of course.
Before we go on comment on break.
Aaron, do you still have your comment?
Yes, thank you so much, Hagar. And I took my hand down because we're in public session, but as it relates to conversations about potential cuts out of Washington, D.C. impacting the services we rely on, the message I want to give is it ain't over. It ain't over, and there's a long way to go. And I'm grateful that we at the State Council on Developmental Disabilities are able to use our independent status to talk to people, to bring, tell them what the situation is, to bring clarity to the confusion, to cut through it, present it in clear ways. What is the situation? And very importantly, what can each person do about it? So I've had that conversation with, I think it's about 1,300 people over the last 3 weeks. That's directly I've had that conversation, and I'm happy to come and have that conversation with anybody here or with your associations. It ain't over till it's over, and we're in it to try to prevent it. Thank you.
Thank you, Aaron. I think we will now take a 15-minute break, and then we'll get back to talking about the MPA.
So come back. It is 11:03. Be back at 11, 15, 16, 17, 18. Thank you. 11:18.
Welcome back, everyone. We're getting ready for the second half of our meeting. This is Sherry Burns. I'm the DACLAC co-chair, along with Hagar Dickman. And during the second half of our meeting, we will hear from the 3 DACLAC subcommittees: Home and Community-Based Services, or HCBS, Housing and Transportation. There we go. Housing and Transportation of the 3 committees, HCBS, Housing and Transportation. After considerable input last year from the stakeholders in the various MPA committees, including DACLAC, California will work to advance 81 MPA initiatives in 2025 and 2026, building upon the work that began in January of 2021 when the MPA was launched. Congratulations on the excellent work that DACLAC, the other MPA stakeholder committees, and the state departments have done in building this robust plan collaboratively. Each of the 3 DACLAC subcommittees will do a deeper dive this morning into their reactions and reflections on the 2025 MPA Housing, Transportation, and HCBS initiatives, and the work that they see is needed to move these initiatives for the 5 bold goals into action this year and next. Unfortunately, not all of the top priorities of the DACLAC subcommittees made it into the final MPA 2025 initiatives, but many did, such as launching the demonstration Medi-Cal transition rent program through community supports for older adults and individuals with disabilities, and elevating the California Transportation Commission needs assessment to expand and improve accessible transportation, and establishing a statutory framework for the development of California's first ever statewide aging and disability no wrong door system. As the subcommittees share their reactions to the MPA 2025 initiatives, and their priority action items for this year. We invite the members of the DACLAC and the public to consider what ideas and recommendations you have for implementing these important initiatives. We also want to know what top priorities you think are missing from this plan and still need to be addressed in the next 3 to 4 years. For example, share of cost reform was a top priority of both the HCBS subcommittee and the impact committee, but it did not get into the 2025 plan. And some priorities got into the plan, such as continuing to help older adults and people with disabilities obtain housing stability through the Home Safe program and the Housing and Disability Advocacy program, but they weren't funded in the governor's initial budget. We know there are a few other important ideas and needs and much work to be done over the next 5 years. The link to the plan initiatives can be found at the end of your agenda. Of course, the subcommittees are also always interested in new members to help work on moving these initiatives forward. Certainly, it will take all of us working collaboratively to make the Master Plan for Aging bold goals a reality by 2030. Please consider contacting the subcommittee chairs, Hagar or myself, if you are interested in joining one or more of these vital subcommittees. Now we're going to hear from the Home and Community-Based Services Subcommittee, chaired by Hagar Dickman. Next slide, please, and welcome back, Hagar.
Thank you. I'm going to actually turn it to Corinne. Corinne Jones, are you on the call? Corinne is going to give us a little bit of, oh, great. Okay. Corinne's going to give us a little bit of an overview of the MPA and to set us up for the point of view of the HCBS subcommittee. And then I'm going to invite the rest of the committee members who will speak to our recommendations and sort of the impact that they're intended to have on people who want to stay in the community and need services to do so. Go ahead, Corinne.
Thank you. By introduction, I'm Corinne Jones, and I'm the Director of Programs at Senior Network Services here in Santa Cruz, California. I've been on the DACLAC committee for some 3 years. I'm an American woman of African descent with reddish-brown hair, and today I am wearing a brown and black jacket. Thank you, Hagar, for this opportunity. Sitting in one of the first meetings regarding the Master Plan for Aging in 2019, it was a little difficult to foresee that the group gathered there would be able to draw together a purpose, a plan, a pathway to make California a place to age for all. The bold goals and strategies have unfolded, though, at meetings in person and Zooming. The purpose has been reaffirmed, and the importance is fully baked into the culture of aging here in California and basically in the country. New York and Colorado, among others, have embraced the concept, and they are following our lead in developing plans. California's diverse population is lifting up equity, ramps and sidewalk curb cuts, subtitles and captions on TVs and phones, flexible work accommodations and arrangements for disabilities, and size inclusions are called many things, but they are hallmarks of the living, breathing document we call the Master Plan for Aging. We know the road ahead looks a little bit cluttered. We heard that on Tuesday during the address to Congress. But this is California. And with us being the 5th largest economy in the world and responsible for 14% of the world's gross domestic product, we are not going to allow ourselves to be kicked around, our older adults and disabled unserved, and backtracking from where we have already come. The Master Plan for Aging is a big picture document, alive, living, breathing, and growing, holding our aspirations for California. And my final word on that is we will not be deterred. Thank you.
Thank you, Corinne. Carol, would you mind putting up the slides again? What I'm going to do is I'm going to facilitate the conversation with a little bit of background so that we're all on the same page about the policies, which could be a little weedy and confusing. So I'm going to just to ask that Andrea and Jamie and Kimberly get pinned as well, because they will be speaking to the policies that the HCBS subcommittee had recommended. And then if you could go to the next slide. So the subcommittee has made 5 recommendations. These 2 recommendations, stakeholder engagement in the transition to managed care was adopted by Initiative 27. And there is further steps that the state has committed to taking as far as a no wrong door policy in Initiative 54. And so we wanted to call those out and say thank you to the state for proceeding with these initiatives. If you can go to the next slide. We wanted to talk about really focus on 2 main subcommittee priorities. One is share of cost reform, which, as has been mentioned before, is a priority for not only the HCBS subcommittee and DACLAC, but other subcommittees as well. And then we have put forward 3 recommendations for reducing administrative barriers so that people who need HCBS, home and community-based services in the state, will be able to receive those services in a timely manner. So if you can go on to the next slide. We just wanted to do a quick overview on share of cost and how it is calculated, and then Andrea is going to talk about the impact of the current share of cost policy on people who need home and community-based services. So share of cost is essentially when individuals have income that is above the current Medi-Cal income limit but have high medical costs, it allows a deduction of all those medical costs to occur in order to count the new countable income. So after that countable income has been determined after medical premiums, and can you go on to the next slide? Then after we determine a net countable income, we reduce all of the medical costs. And if those medical costs are leaving with the individual with $600 of income every month, then Medi-Cal will kick in. But Medi-Cal won't kick in until the individual is left with only $600 per month of income. So I think all of us know here that nobody in California can live on $600 a month. And so there's been a lot of talk about reform and a lot of effort around reforming this policy and bringing the countable income, the share of costs maintenance need amount to 138% of the federal poverty level. So I'm going to pass it to Andrea now, who's going to talk about the inaccessibility of the current share of cost program and what is that impact on consumers.
Okay, again, good morning, everybody. I'm going to pretty much share a story. Again, my name is Andrea Robert, and I'm here to represent myself, my colleague, our community, and also my mother-in-law. Many individuals are excluded from essential in-home supportive services and community-based services due to outdated share of cost policies. Mrs. Pink is 85 years old. Following a fatal car accident that resulted in the loss and death of her sister, she underwent major surgery from her legs and wrists, and also suffered multiple broken bones in her nose and chin. She currently lives in a 350 square foot apartment with very little income and resources. Until 6 years ago, she was very active. In 2018, after the accident, she relied on her son for round-the-clock care for over 3 months and eventually had to pay for additional care. She received home services through Medicare for 90 days. I helped her apply for Medicaid, and her monthly income is $2,131. Unfortunately, we were disappointed to find out that her share cost was $1,330, which is an amount she cannot manage to pay to access in-home supportive services. This amount was determined after all deduction, including the current $600 maintenance need levels. Because she is enrolled in Medicare Advantage Care Part C, she cannot purchase any additional Medigap policy unless she switches back to original Medicare. This information can be found in their annual Medicare and You booklet. While Medigap insurance policy can cover additional need like prescription drugs, vision, dental, and other medical services, they cannot be purchased by those receiving Medicare Part B plans. If she attempts to buy these Medigap policies, she would risk being unenrolled for Part C plan. This deductible applies mostly to people that are enrolled in original Medicare. This is a common misconception. Many believe that plainly purchasing a plan with a monthly premium is all that is required. In order to eliminate her share of costs, she must provide evidence of deductible expenses, such as health insurance premium and out-of-pocket costs. The majority of her health expenses are covered by her Part C plan, which offer additional benefits. However, these do not completely eliminate her out-of-pocket costs. She cannot depend on this option. This situation highlights the need to push for share of cost reform, ensuring that more individuals can qualify for in-home supportive services and other community-based programs. Medicaid does not take in consider her rent, other expenses, causing her to exceed the income limit for free coverage. Lastly, for 2025, the average monthly premium in California is projected to be $12.48. And there are over 465 Plan C plans available in the state. Most of these plans cover the majority of the healthcare costs. My personal ask, raise the maintenance need level to 138% to align it with the current income eligibility limit for free Medicaid for my mother-in-law, myself, and others in need of services. With the share cost reform, her share cost would be more affordable at $125 instead of $1,330. Thank you.
Thank you, Andrea. And before I move us forward, I wanted to connect Andrea's comments with what Corinne had started the conversation with, which is that the HCBS subcommittee feels that the MPA is an opportunity for us to express our big goals for California, our big vision for California in improving access to services. And share of cost reform has been identified as the #1 priority for exactly the reason that Andrea just pointed out. And so when we're talking about the priorities for our subcommittee, this is really the context in which we are providing that feedback, that we think that these recommendations that the HCBS subcommittee has made really go towards the core foundation of what DACLAC is focused on, and also what the state should be focusing on going forward for the direction of the state as far as access to services is concerned. So I'm going to, if you don't mind putting up the slides again, we're going to go to the next slide, and Kimberly is going to be talking about the importance of reducing administrative barriers to Medi-Cal and Medi-Cal services. There's an explanation here. I'm not going to read it. There's an explanation here on the slide of what these policies do. The first one goes towards share of cost and making sure that services are accessible from the first of the month for individuals with share of cost Medi-Cal. The second, presumptive eligibility, is really all about making sure that Medi-Cal applicants who need HCBS can get Medi-Cal services on the day of application. And then prompt coverage, again, is all about making sure that when somebody needs home and community-based services, they can get those services when they apply rather than have to wait for a variety of hoops that they must jump through in order to get certified and get services going and approved at the state level. So I'm going to stop there and turn over to Kim.
Thank you, Hagar. My name is Kim Mills. I'm the CEO of A Better Life Together. We are a provider of a regional center in Southern California, which is under the Department of Developmental Services. We are currently serving an individual. We provide a lot of services, supported living, independent living, which is similar to supportive housing and other departments. And we currently are providing supports to an individual, male, who is battling stage 4 cancer as we speak, that was in his colon that has now moved to his liver. We've reached out to our regional center, requested additional hours. We were providing things like helping him budget and paying his bills and maybe finding a job and things like that. But when his health deteriorated, we identified that there was need for a higher level of care. So we reached out to our regional center. We presented the case, planning team meeting. It was determined he would get it. This was 2 months ago. We are still in the process of waiting for that service, the additional services to be in place. In the meantime, we also applied for IHSS. IHSS has a 60-day turnaround from applicant to actually receiving services. We've also reached out to home health because in addition to the cancer, he has a diversion in that colostomy bag that helps him relieve himself because he can't do that anymore. ILS does not do that. Our staff we're person-centered. We're there to teach and educate and support an individual as they're in the community. We love HCBS and what it stands for. Everyone should have a right to be in the community of their choice, and services should be brought to them. However, with not having access to these additional services without going through hoops, and everybody having their own process and procedures for getting things approved, it has been a huge burden for this individual. And so we have staff that are working around the clock, fighting with the hospital. He currently is hospitalized again. He was in the hospital for 3 weeks while he was getting the colostomy bag, and gave us time to work with our regional center to get services in place for him. But everything takes time. So the hospital is forcing him to leave. They're trying to find him a nursing home. They called 41 nursing homes. None of them had an opening. He finally gained enough confidence to change the bag, and we were told that that he would have home health that can help him. Once he got home, he realized this is too much, and his health started deteriorating. Once he started going to chemo, then things got worse, and he no longer had the strength to do that. So here we are. I have an individual that had a roommate who was also a staff person who got woken up in the middle of the night to assist him changing a colostomy bag. He had no training. He just went off the guidance of what YouTube and this individual told him. Luckily, they were able to manage it. But again, it's beyond our scope. We're desperately trying to get additional services, but every time we request something, there are lots of procedures in place. Without provisional eligibility, we're still waiting. In the meantime, this person's cancer is aggressive, and he is essentially currently as of today, being forced to leave the hospital. They finally found one, because I convinced him to go back to the hospital because he could not walk after his first chemo, because he couldn't get a ride to the doctor's appointment. I said, we're gonna have to call an ambulance. Took him to one hospital. They left him in an emergency room for 3 days because they didn't have a bed. They found a sister hospital that took him. Currently has been there for a week and a half, and they're now telling us he has to go home. We're saying we don't have services in place for him to go home to. This is not right. So they said we finally found a nursing home, a skilled nursing facility that would take him, but they don't take people on chemo. What are we supposed to do? So if there is this goal of no silos and no wrong door, I know we can't really blow up the silos, which would be my dream as a provider, because cancer doesn't have a timeline. He needs help now. Can we start building the door one brick at a time as we tear down the silos? And with presumptive eligibility, we can do this. We say no wrong door was approved for the master plan, but how do we achieve that? So a person needs all of these services from every other department that's in the state under HHSA. Why can't we access to them? Why can't there be a centralized place to do assessments? One assessment for everyone, so that everybody has access to it. And then it's just a phone call, not an assessment. IHSS requires a doctor's note to approve it. This person was in the hospital. The hospital staff did not want to sign the form. We had to beg them, can you please sign it? Because he needs this service. He finally got service after 60 days. Now he's back in the hospital. We're saying, let's wait, please stall. You don't have the services supports in place still till we get things in place. I'm advocating at the top chain of my regional center to say, hi, what's going on with our request for more supports? They had a nurse coming out to do an assessment February 2nd. We still don't have the report because now she's on vacation. It's mind blowing. I told Hagar in our HCPS meeting to say I'm frustrated is an understatement, because as a provider and an advocate, you're passionate. You really want individuals to live in their own homes and live their best lives, but you have to work within a system, and the system is complicated. And while I don't disrespect the procedures that are in place, I know they're in there for a reason. If we are really a California for all, we got to change. I know we're worried about the changes coming from the federal government, and we got a plan for that. But today, I have an individual who needs help, and we're one of those agencies. We just get in and do what needs to get done, and deal with it later. I don't have the capacity. I need help. I'm out of my head. It's above my head right now, and we're asking the hospital, please back off and let us wait until we can get some things in place, and we're stuck. So any assistance we can get, and I'm hoping that the initiative for provisional eligibility and prompt coverage can be reconsidered, because it's crucial. And the plan is great. The plans aren't that great, or just paper, unless they're really making a difference in people's lives. Thank you.
Thank you so much, Kimberly. I think Janie is going to bring it all together for us. And if you don't mind showing the slides, I also wanted to make sure that we recognize the rest of the home and community-based services initiatives that are in the MPA. So Carol, if you don't mind putting those up, so we could at least, while Janie is talking, take a look at them. There's another page as well. And so just taking a look, you could look at your materials as well. And then I'm going to turn it over to Janie to wrap things up for us. Thank you.
Thank you. And thank you to the gals that spoke before me. I just wanted to say, first of all, introduce myself, Janie Whiteford. I'm the president of CICA, which is the California IHSS Consumer Alliance. And we represent the 850,000 consumers on IHSS. We're a membership organization of all the advisory groups, advisory committees that are mandated by law, and every county is supposed to have one of these committees. So we currently have 28 counties who are members of CICA. We understand and we know how difficult these programs can be. The recommendations that we give for IHSS, I mean, they are profound. We know we need more social workers. We know we need more, the whole issue of providers and that help our folks, that help our CICA consumers, and what's going on with them, and the lack of affordable income that they're getting currently. These are all huge, huge problems. Unfortunately, they all take money. And I think we look back at everything that we're asking for. We are so thankful for the state that everything that they do, they realize that it takes money. Unfortunately, it's a state we're not in a great financial position, and we are incredibly concerned about what's coming down at the federal level. So we know that they're talking about financial reductions, but there are also potential other reductions that would affect all of our folks that receive HCBS. Looking at the master plan for aging, as much as I hate to say it, we have to look at what these cuts would mean, and we can't allow that to happen. The master plan for aging requires that we move forward, and we want to move forward, but we are going to have to fight very hard to make these cuts not happen. I know and unfortunately, we're looking at a fight that is at least 4 years. So I think that asking all of you to do what we can do. I know Hagar put in the chat that they are taking stories from folks, and that you can send them directly to her for Justice and Aging to utilize. There are other organizations that are asking for stories. Those stories are incredibly important, whether they come from IHSS consumers or those folks that use food stamps, which could be, I know all of us need to jump into this fray and provide those stories that we can use with our legislators. So thank you very much. And I really thank everybody for pushing forward and being in this wonderful group that is so important for all of our consumers.
Thank you so much, Janie. I'm going to turn it back over to Sherry.
Here we go. Thank you. Great discussion from the HCBS subcommittee. I think before we move to the housing subcommittee, we have Joseph Billingsley with Department of Healthcare Services that has some comments he wants to share. Joseph?
Yes, thank you so much, Sherry.
You're welcome.
Appreciate the opportunity to join the meeting today. Really appreciate the opportunity to hear all of the input from the subcommittee, and just agree with the importance of the work that you're doing. I did really ask for the opportunity to join today just to be able to speak to the committee and just update on a few things. One, we've talked about this here at the committee before, but DHCS has been working on its home and community-based services gap analysis, Medi-Cal gap analysis, HCBS gap analysis, and also subsequent multi-year roadmap to identify pathways for working to address identified gaps. So the first phase of that has been completed. Last month on February 14th, we did release the gap analysis. And so it was sent out to stakeholders. Hopefully folks on the committee received that, but I'll also post a link in the chat. And then also identify for everyone that will be providing a fuller update on the gap analysis in our stakeholder meeting that we're hosting next week, along with California Department on Aging. And so that will be on Thursday, March 13th from 1 to 2:30 p.m. And the link I'm posting will also have information on that stakeholder meeting. And then really what I wanted to update on today is just to make sure that the committee is aware and also ask for your support in putting out messaging that as part of our now shift to roadmap development process, we sent out a call for nominations yesterday for a new work group, which will be charged with advising Department of Healthcare Services on proposals to better integrate home and community-based services for Medi-Cal members. And so this work group will be charged with reviewing policy options and proposals for Medi-Cal home and community-based waiver programs, including opportunities for integration into the Medi-Cal managed care delivery system, and also to support services through fee-for-service as appropriate. So we are the work group will be led by DHCS and will also include participation from our other impacted departments, including our Department of Aging, and then really for this work group, we're looking for a representative group to help inform the department's work. We're looking to have on the work group Medi-Cal members that are receiving HCBS, caregivers of Medi-Cal members receiving HCBS, also our Medi-Cal managed care plans and or their associations, the different waiver case management entities that work in each of our different waivers that we're looking at for integration into our managed care delivery system, and then also direct providers of HCBS services, and then also policy experts and our consumer advocacy organizations. So we've put out that call for nominations. We've sent it out very broadly. It's also in process of being posted to our website. It'll be at the same link that I'll be putting in the chat. So that should be coming up by tomorrow. And we've asked individuals to provide nominations or responses back by next Friday, the 14th. And really, again, appreciate the community's assistance when we think there's, members of the committee and also members of the public that are listening in that will likely be interested in this work group and participating in it. So we look forward to receiving a response from you, but then also appreciate your support in helping to disseminate that to other interested parties that you think should have a voice in this work group process. So really, that's the update I wanted to provide. Appreciate the opportunity to use this committee and the broad reach that you have to help provide out this messaging.
Great. Thank you, Joseph. Yes, perfect timing. And thank you for you and your team's work on the gap analysis. And we definitely hope to get some good responses to the work group. And it looks like Sarah put in there, CDA also will be pushing out that notice besides you putting that in the chat for this group, Joseph. So thank you. We're going to move now to the Housing Subcommittee. Marty Emoto with CDCAN. This will be his last time chairing the committee, but joining him today is Carolyn Nava with Disability Action Center, Kimberly Mills coming back from A Better Life Together on this subcommittee as well, and Corinne Jones with Senior Network Services. That next meeting, we will have Lauren Carden, who's Justice and Aging's new Director of Housing Advocacy, joining the subcommittee as the co-chair. Now I'm going to turn it over to Marty.
Thank you, Sherry, and thank you, Hagar, and also the other members of the HCBS subcommittee. Appreciate the update and the information. I wanted to also add that Corinne Jones she was drafted and later volunteered to be the co-chair of the housing subcommittee. That's what happens when you you're in the meeting, then you have to go away to catch a plane. And so we put her on as co-chair without objection. By the way, we decided the co-chair is a lot faster than the House of Representatives chose a speaker last year. So, there was no problem in picking these two fine individuals to lead the subcommittee. I just want to say, though, that, and we're going to go through this quick, and also want to also invite the other members of the subcommittee to join in after the panelists complete their updates. I want to say that there's an overarching view that we took in terms of our subcommittee meeting on February 26th. One is, which Hagar and others spoke to earlier, is the impact of what is going on in Washington. The changes, not just to Medicaid, but all the other potential cuts, real or not, that will impact a person with disabilities, developmental disabilities, people with behavioral health needs, and older people and their families. And I want to remind people, it also includes the people who provide services, and we cannot forget those individuals who provide the supports and services, for instance, to my son right now as we speak. It's so important to know that the impact, whether it's Social Security, special ed, Medicaid, any of these things, housing, transportation, food security, all these things can impact a family, an individual who provides services, as well as a person who needs it. So that's going to be something that overarches all these initiatives from all the subcommittees that we deal with, that we're going to be really responsive to. And again, this committee has spoken to that, to be responsive when the response is needed. Also, we were talking in our subcommittee about the impact, though we didn't get into detail, of the loss of homes, the loss of businesses that serve people with disabilities and developmental disabilities, resulting from the LA fires, and also looking forward to future natural disasters that the state is likely to face in the coming months. And how do we respond to that? How does that impact the implementation of all these initiatives? Because it does. Also, the governor's proposal in January, which obviously is going to change dramatically when he releases his revisions to his budget proposal, called the May Revise. One of the proposals he made, and there's no details presented. It's not certain. I don't have any information whether or not they're still going to present or go through with this, but it's the creation of a new agency, a housing and homelessness agency. And we'll see where that goes. It's part of the government reorganization plan that the governor said he would, at least in January, submit to the Little Hoover Commission, and from there, depending on what they review, will then go to the legislature for final go to the legislature. So that just kind of overarches our discussion about the master plan for aging housing initiatives, and I'll go through it, and then the panel that follows me will speak to specifics about the implementation of many of these initiatives or priorities. And I'm going to go through it really quick, and I'm not going to read every sentence, but for the benefit of people who are participating in this meeting, but they're not having access to the visuals, I'm going to read just quickly just a couple of the lines. So initiative 1 is protect housing supply, housing assistance, and housing supports through coordination at all levels of government. One thing that we did mention in our discussion in the subcommittee, and this applies to several other initiatives, is that we got to make sure that when we mention the agencies or departments responsible for the key roles and implementation, that we make sure we mention departments where people can see themselves in it. And so one of the things that we noticed, several of us, missing from the key agencies who will have a direct role in implementation, is there was absolutely no mention of the Department of Developmental Services, no mention of regional centers. And even though people with disabilities are mentioned in all the initiatives, I don't see my son in this specifically. And I'm to Andrea's point, anything that we do in terms of efforts and outcomes, and to the efforts that we all talked about, we need to see ourselves in this. And so sometimes it's a commercial that we have to give to ourselves and teach ourselves that, to Kim's point, we don't break the silos overnight. And that's a problem that we created among ourselves as advocates and also our state partners. And you know what? Washington can do whatever it wants, but this is something that we can do, and we have to do it every day. So I want everybody in this meeting, when you talk about an older person or you talk about a person with disabilities, think of a name. Think of my son, or think of some individual. Because we have to get used to doing that. Because if we don't do that, then any cut that's going to happen in Washington is going to not only hurt countless Californians, it's going to divide us, because guess what? We're already divided. We're still in silos. And we could talk all we want that we are not, But Kim just mentioned today in her update that the silos exist. And it doesn't mean that it's done by bad people. It's good people still doing the same thing, and we all need to change. So number one, let's just make sure that we're talking about, that we're listing all the agencies that really need to have a responsibility for implementation. Number two, protect promising practices and encourage replication of innovative public and private housing solutions, including rental subsidies and shared housing models in partnership with local leaders. This is something that is happening, and some of the panelists will speak to that. Number three, report annually on the most recent publicly available data to track housing-related efforts and outcomes serving older adults and people with disabilities. This is going to be important. In our discussions, we didn't notice that this has been implemented yet. I want to add, though, and one of the discussions that we did have, though, is that whatever report is obtained in terms of data, it cannot just be utilization numbers, meaning how much money was spent and just the numbers of how many people were served. It is an outcome, but that's the voice of government speaking. And what we need to insist on, that the voice of individuals being served, the voice of people providing the service are there too in terms of real data, not just personal stories, because people can dismiss those. It needs to be considered hard data equal to utilization, meaning the whole person-centered needs and goals tied to the outcomes to those needs and goals. And that is real data, and we need to work on that. Next slide, please. By the way, I want to do a shout out to the incredible team from California Department of Aging, CDA. You guys do incredible work facilitating this meeting, Carol and the rest of the team there. You guys are awesome. And also a shout out to the ASL interpreter. I hope I'm not talking too fast. Number four, launch the California Behavioral Health Community-Based Organized Networks of Equitable Care and Treatment, otherwise known as BH Connect, and for good reason. And that includes the transitional rent program that is scheduled to be going to implementation July 1st. And also to report on how this is impacting older adults and people with disabilities who are eligible for these services. This is potentially a transformative effort by the state of California, and we should really thank the Department of Healthcare Services and all of our state partners and the advocacy groups that have really pushed this forward. And Governor Newsom did go back to Washington in November after the elections and again in December to make sure that the Biden administration approved all the pending waivers that were still there at CMS, and this was one of them. Number five, continue to create and preserve housing options for people applying for or receiving SSI or cash assistance program for immigrants through the Community Care Expansion Program. Number six, continue to help older adults and people with disabilities obtain housing stability through the Home Safe Program and the Housing and Disability Advocacy Program, HDAP. That's under the California Department of Social Services. Next slide. Number seven, identify affordable housing opportunities for vets made possible through Prop 1, inclusive of older adults and people with disabilities with behavioral health challenges. We didn't really address and talk about this in our subcommittee in terms of what specifics have been done. So I hope someone from the rest of the subcommittee could either speak to that or from the full committee. Number eight, present analysis of California's affordable housing supply for older adults and people with disabilities through the Home and Community-Based Services HCBS gap analysis. Now, Joseph Billingsley spoke a little bit to the gap analysis study that was released and will be talked about. One of the issues, and again, they did speak to us at one of our earlier subcommittee meetings. One of the things that I hope will be addressed not hope, as an advocate, I'll be off this committee, but as an advocate, I will press them, if they don't want me to, that whatever reasons the people who are under the developmental services waiver were not included in the HCBS gap analysis, the Medi-Cal home and community-based services gap analysis needs to be raised, addressed, and recommendations of how do you correct that. And so we need to have that raised and corrected. Number 9, analyze spending from California's housing finance programs to determine the impact and benefits to older adults and people with disabilities. Again, outcomes cannot just be utilization. Outcomes need to be, how is it tied to a person's needs? Next slide. We're getting to the last. Develop tools and training to educate housing continuums of care, aging and disability networks, including area agencies on aging, ILCs, independent living centers, health plans, hospitals, county welfare departments, and community-based organizations on how to coordinate benefit and support services for older adults and people with disabilities who are at risk or experiencing homelessness. Now, this is a good example where you read that, and if you have a child or an adult with or a provider who serves primarily people with developmental disabilities, you're looking to see, where am I? And I don't assign any nefarious reasons why regional centers or other types of people who serve people with developmental disabilities are not listed here. But you know what? I don't care what your reason is. Fix it. We need to fix it. Okay? Because when I read this kind of stuff, I want to see my son in it. I want to see my sister. I want to see it. And it doesn't hurt to add 2 more words. And again, I'm sure no one did it intentionally, but harm is also caused by people who just don't do things intentionally. And I know that from personal experience. So let's fix that. Number 11, expand emergency shelter emergency housing assistance, and provide supportive services for victim survivors of crime with specialized needs, including older adults, people with disabilities, LGBTQIA+, non-English speaking or culturally or religiously marginalized population through specialized emergency housing. We didn't really speak specifically to this, and I hope the rest of the panel will, but I do want to raise an issue that in terms of the fear and panic and what's going on in Washington, D.C. and the impact, one of the things we didn't really talk about is the impact and the fear to people who are not documented in the country, but specifically in the state. Many of the families that we serve, whether it's people with developmental disabilities or other disabilities or behavioral health needs within their families, or the people who provide supports to them within their families. In my family, we have people not documented. The fear is real. And we need to make sure that we somehow are responsive to that and figure a way to respond. Number 12, and the final one, is implement the Veterans Support through Self-Reliance pilot project to identify and evaluate models that help aging, highly vulnerable veterans with homelessness experience who are residing in permanent supportive housing with on-site enhanced supportive services to keep them stably housed. And I think that was, yeah, that's it. I'm going to turn it over. And again, we'll, after the 3 panelists, we will have time to allow the rest of the subcommittee to join in. And I don't know if we'll have time for questions, but I'm going to turn it first over to the new incoming co-chair who took a flight and got appointed, Karine Jones, and then she will be followed by is Carolyn? Oh, there you are, Carolyn. I see you. I'm just looking at my screen. Carolyn Nava from up north, Chico and Redding from the Disability Action Center, my favorite ILC, next to all the other ILCs, and then followed by Kim Mills from A Better Life Together. Karine, I'm going to turn it over to you, and then I'll do a close up before I turn it back over to Sherry. Oh, and you're on mute. You're still on mute. I will
Hey,
soon
here we
be on
go.
mute.
Yeah, it's one. 10 years into Zooming, we're still doing this stuff. Thank you, Marty. You've been the best. I just want to say that while I believe we will continue to focus on progress as advocates for the people who need us, we were reminded on Tuesday evening at the address to Congress that the priorities of California's most vulnerable will take a back seat in the agenda of the billionaires who are now in charge of the federal dollars we will need to ensure housing for our older adults and disabled citizens. Thankfully, we are in California. I want to remind all that we will not abandon our direction. We will not stand idly by while our efforts are gutted by the new administration. Housing like air is not a luxury, and those of us with voices must prepare to become louder, more vocal, more observant of what is being done, and more watchful of the effects of what is being done. We may come under intense attack, and we will need to prepare to respond in all legal ways available to us. Gutting the Forest Service will not help California wildfires. Stripping the Medi-Cal programs that offer housing as a part of social determinants of health. Increasing penalties, policing, and removal of homeless encampments will not ease the problem, no more than making homelessness a crime will eliminate it. This committee will continue working to find solutions and answers that make sense, are impactful, and real to confront the housing crisis that is traversing up and down this state, and that is regardless of the rhetoric coming from Washington, D.C. Thank you.
Thank you. Carolyn Nava, the house is yours.
Thank you, Marty. Thank you, Corinne. I want to first begin by giving a little bit of a nod to Barbara, who this morning brought something very important into the conversation today. Our center provides enhanced care management, and our systems change advocacy efforts strategically placed our direct service provider team members on the board and advisory committee of one of the major managed care plans in the region, as well as we have done the same at some of our local health centers and hospitals. We feel by doing that, we're moving in sync with what really has been for some time a powerful and influential voice at the Medicaid table. This did not happen overnight, seeing that transition with the care plans having this much power. We've been watching that for quite some time and said, we better be on top of this one. And that's how we've brought our presence to the table in our far north region. I'm going to turn very quickly now to the fires and giving a nod to the efforts and the pain that is being experienced throughout the LA community. We've been there. The Camp Fire, which happened less than 10 miles from our nonprofit center location, that was a zero spot, remains the #1 deadliest and most destructive fire in California state. So it's no surprise that we're still recovering from its effects, and our heart goes out to everyone in LA. We've learned and continue to learn a lot from that community experience. So if we fast forward now to current day, 24-25, we turned our attention to home sharing. That kind of matches the thoughts about our priority housing initiative #2, where we're going to protect those promising practices and encourage the replication of the innovative public and private housing solutions. We are taking that quite seriously and supporting the only house sharing organization, community-based organization in our region, brought them under the fold of our local master plan for aging advisory committee project scope. And we are now working with them to expand those house sharing efforts throughout our far north region. Now, why is that important? What kind of impact does that actually make? Well, so far, this little mom and pop agency, with our support, has provided 38 total matches, housing 77 people. That may not seem like a lot, but if you're one of those 77, it matters, right? So our first match is about to celebrate what we call their 4-year match anniversary, right? So we're finding people in the community, putting them together. This particular home is now comprised of a veteran with traumatic brain injury who was matched with another individual in the community, older adult, who needed help and support around the home and just wanted companionship, a friend to eliminate the social isolation. So when we look at that, we also now, in the wake of the park fire, which the park fire started 1 mile from our center, right? So we're just right in that hot zone. But we said, how do we respond to this, right? So then we think again about the partnering with local leaders and the subject matter experts as part of this initiative. It's a grassroots effort. On the heels of the park fire, we added another layer to that home sharing element, and we call it the Recovery Home Share Program. And this is where community members can do a temporary housing for individuals directly affected by the fire. So you have an extra room and you can step up, and we're organized to provide temporary housing for individuals still working with FEMA channels, still working through injuries to get back on their feet. They now have a temporary place to launch from to get their housing back in order. And that was a direct response to the fire. That fire burned 429,000 plus acres. It was ridiculous to think about the size and scope of it. But that has been our response, not the gloom and doom, but to say together we've got some power here. And then finally, I want to give a nod to a comment in the chat. And it affects, I believe, our housing priority number 10 about eliminating those silos. Marty, you spoke quite a bit to that in your summary. And one of the things that we have historically done in our far north region in collaboration is work directly with our far northern regional center and our North State office of the State Council on Developmental Disabilities. I know that Aaron is here. Aaron, I don't know if you remember me, but you came up and you spoke at a listening session that I conducted 7 or 8 years ago here in Chico, California. And I was so appreciative that you took the time to come up, because many from our DD community were there in that audience and were given a voice about how they were being affected by that devastating fire. And I always remember that. And I thank you again for taking the time to do exactly what you said you would do today, which is be there, show up, help everyone understand the support is there for them. So our regional center is also a committee member in our Rural Local Master Plan for Aging Advisory Committee. It's the only way to do it. You have to communicate, you have to collaborate. We have a long-standing relationship with our regional center as well as our state council on developmental disabilities. Our North State office, the Far Northern Regional Center, was actually at the table with our Center for Independent Living more than a decade ago when we formed the Diverse Ability Advocacy Network, which is now on the national map for sharing how we're doing what we're doing. But it was just the 4 of us back then, and look at where we are now. So I think the point here is in getting these initiatives launched, it's not just on the state, it's not just on the federals. There's always going to be fluctuation there. But when you have to see your neighbor in Safeway and explain why you didn't do something, it's a little more challenging. So we just brought them all to the table, folded them in at our center conference room at the Center for Independent Living and said, okay, let's rock and roll. And that's just some of the results that we are having. We're happy to, share our little bit. It's just a small piece of the puzzle up north here. But our experience and our hard knocks and our disasters have created an element of opportunity, and we've taken advantage of that. And we appreciate being a part of this DACLAC committee and just taking it to another level.
Thank you so much, Carolyn. And actually, it segues very nicely to, or as a reminder to the issues that Kim brought up earlier and also in our subcommittee meeting last week. So, Kim, I'm going to turn it back over to you with your fantastic voice.
Thank you, Marty. I'm trying to exhale because as we speak, the hospital is kicking him out. A cab is coming to take him home without any services. We're going to do our best. That's all I can say. I'm so angry. Anybody get so angry they can just cry? That's how mad you are. That's where I'm at today. But anyways, the work needs to be done, and he doesn't have the energy to fight. So we're going to fight on his behalf. I want to. So Marty, you talked previously about actionable items and things that we could do now. I'm saying, can we do what Carolyn's talking about and doing maybe a local advisory? Love to get people at the table, even I'm in San Diego area, because what we're talking about, taking down the silos, is huge, is lofty, right? So many cumbersome things going on. What can we do now? Because again, that is the benchmark where everybody should be at. Well, what about today? And what can we do today? How can we get people in the room? I want to put all the directors, can all the directors get in a room across the state with a locked door and say, don't leave until this is fixed? It's not reasonable, right? So what can I do as a provider, an advocate at my local level to help? All I'm doing is calling and being frustrated. But nothing seems to get done because, again, everybody has their procedures in place. And again, I'm a big proponent of don't tear it down unless you know why it's up in the first place, because they're there for a reason. What can we do in case somebody needs prompt coverage? Housing is important. What I do is assist adults through the regional center to get housing. And then we provide a level of support after we assess them. And this person has housing. And it was complicated because where it was at before was upstairs. He could no longer climb the stairs. And it wasn't really in a sort of like an extra room added to a house. Wasn't even probably up to code. We so happened years ago to create an opportunity to have housing in a home that I was able to, a duplex I was able to purchase. I started another company because we couldn't find housing. I'm in San Diego, very expensive housing. And as many of you probably up north can well, all over across California can attest to. And so with our people being on Section 8 waiting list forever, sometimes finding housing is just horrible. So people wait to even get into their own home. Forget about the dream of HCBS. I just don't want to get out of this group home. I want to be in my own home, living my life, but there's no resources. So while it's encouraging to hear about all of the housing plans and the dreams, because I think it's in every budget, every year, and everybody talks about it. What are we going to do about it? And can we do something? Where can we start? I'm just frustrated because I don't even know where to go. I have staff now that are on the phone right now trying to get staff in place for him because he's on his way home as we speak. And there's no IHSS in place yet. We finally got hours approved. Now we got to find a provider like yesterday. And so I love being a part of this committee because I'm learning so much about what else is acceptable or available to individuals through the regional center, because I didn't know what Medi-Cal offered. I didn't know what they were eligible for. And I'm a big proponent of California for All, which means the people that I advocate for in the IDD system, they deserve everything that everybody else is entitled to. And I would also echo what Marty says. I would like to see when it says people with disabilities, really identify people with intellectual and developmental disabilities. And I realize that there is a master plan for DD. And I have mixed feelings about that, and I'm a part of that community. Why? If we're California for All, do we need a separate master plan? And I hope that they're similar and that there's lots of crossover, because again, it'll just be two pieces of paper with lots of goals on it. And in the meantime, people are dying and they need services now. So Marty, you did a great job already of summarizing our initiatives. And my voice is gone. It's been gone for a long time. But I'm going to shut up because.
No, well, thank you, Kim. And one of the things
Thank
that
you.
Sherry and Hagar promised is going to send you a big gallon of cough syrup before the next meeting. And
That
I'm going to
helps
turn this.
us.
I'm going
And
to turn this over, but I do want to do a shout out to Susan and your team and the state, generally speaking, all the agencies, the administration, for taking up the master plan for aging. I served on the subcommittees. It is a remarkable effort. It was a remarkable effort, and we're here today with a lot of transforming changes. And Susan, I'm looking at you. When you were an advocate, we didn't think even half of these things would be made into reality, and they are. And so we're talking about more about the implementation of, maybe fine tuning or how do we make these better. But it wasn't back in the day, and it wasn't that long ago, we were just dreaming and hoping that even half of these things would even be put on paper. It's put on paper, and now they're being acted on. And the purpose of this subcommittee, all the subcommittees, is how do we make it really happen so that it really impacts people's lives? Because that's what advocacy does, is always improve upon what we did before. And lastly, before I turn over to Sherry, the whole need is what Kim spoke, what Carolyn spoke to, what Corrine spoke, and what others spoke to, is the need for whole person-centered goals tied to outcomes, so that those are data points too, equal to utilization. Numbers lie if you don't have the other parts of this, which is the goals, was a goal or the need of the person met when they needed it. My son Alex, when he lost his mom 5-6 years ago, when he lost his home, when his mom died, he lost his home. And I will tell you, I was there, but it wasn't by design. And I will also tell you, he doesn't show up in anyone's numbers as a person who lost his home, who was at risk of being homeless, and for a while was. And we just got to do better. But I also wanted to say thank you to the state for all its efforts on the master plan for aging. Pretty remarkable. And I will leave you with that, and I'll turn it over to you, Sherry. We're a little over time. I will blame that on Hagar.
Well, there's so much to talk about, and thank you for reminding all of us how far we've come. We have accomplished a lot together, working with our state partners and everybody. And Kimberly, regardless of your gravelly voice, we heard you loud and clear, and so we're right there with you. I'm going to turn it now over to Michelle Rousey, who's going to talk about what the transportation subcommittee has been working on with their priorities. Michelle.
I'm Michelle Rousey with the DACLAC Transportation Subcommittee, and I do want, before I go any further with my presentation, I want to put a shout out and welcome to Allison Joe, the Deputy Secretary of Equity and Workforce at CALSTA, which is the California State Transportation Agency, and our new liaison for this work with CALSTA, with our transportation subcommittee and the DACLAC. She is an excellent, and I look forward to working with her on these issues. So welcome, and thank you everybody for having me speak today. I'm Michelle Rousey for the transportation subcommittee chair. We can move on. Go ahead. Next slide. Okay, thank you. Okay, so with the master plan on aging and transportation, we have been elevating certain points with the master plan on aging, and 13 is to elevate the Transportation Commission, which is the CTC, needs assessment to expand and improve accessible transportation. And if I need to go slower, let me know, because I do sometimes speak very fast. 14, include recommendations in the final Transit Transformation Task Force report to improve the provision and governance of accessible transportation services, which is CALSTA. 15, improve transportation navigation for older adults and people with disabilities by streamlining the eligibility process for benefits and standardizing definitions, and facilitating easier access to discounts through the California Integrated Travel Project, the CALIP. So, 16, present analysis of the transportation data and access to affordable, accessible transportation for older adults and people with disabilities through the Home and Community-Based Services HCBS gap analysis with Cal HS and CDA and CALSA. Is that the last one? Okay, here we go. SB 1121, the CTC transportation analysis. I think that's what it says. The last top part gets cut off because of okay, never mind. Elevate the Transportation Commission CTC needs assessment to expand and improve accessible transportation. Bullet point. Ensure there is a section of the SB 1121 needs assessment draft report mentioning accessible transportation is done. Encourage cost assessments for accessible transportation prior to the next report in 2013 via CTC and State Transit Transportation Task Force. Next slide. SB 125 Transportation Task Force, including recommendations in the final Transit Transformation Task Force report to improve the provision and governance of accessible transportation services. Ensure Transit Transformation Task Force agenda item covering accessible transportation. Done. Propose recommendations including funding needs, removing fixed route limitation, recommendations for rural areas, enforcement of SB 1376, wheelchair accessibility for TNCs. And if people don't know what TNCs are, those are like our Uber and accessible vans for wheelchairs. So we should probably write that out in the future. Streamline benefit qualification, ensure mobility manager per county, more based on further discussion. Bring recommendations to the Interagency Equity Advisory Committee, we call it the EAC, and encourage spoken and written public comment. Improve transportation navigation throughout. Improve transportation navigation for older adults and people with disabilities by streamlining the eligibility process for benefits, standardizing definitions, and facilitating easier access to discounts through California Integrated Travel Project, CALIP. Include a recommendation through SB 125, State Transit Transportation Task Force, and create recommendations for local and regional agencies. Present and home community-based gap analysis. Present analysis to the transportation data and access to affordable, accessible transportation for older adults and people with disabilities through home and community-based services gap analysis. Hear presentation and provide feedback about opportunities to utilize data, advance system improvements. Next slide. Is there a next slide? Okay, there we go. Public comments. Attendees joining by phone, press 9 on your dial. Okay, staff, you can go back to this. So, you know, for me, as being chair of the transportation committee, I really want to open up that I would really like other members of the DACLAC to join the subcommittee, but also that, you know, we really are looking at ways to develop and give feedback to our transportation agencies on master plan on aging for transportation issues. And we need your feedback. We need your participation so that we can look at things that need to happen going forward. So, and I'd like to open it up to questions if people have them. I just want to reiterate how important transportation is when it comes to seniors and people with disabilities needs. Without transportation, we don't get food, we don't get to our doctors and other things, and it's an overlooked system, and it needs a lot of work on it, just like some of our other home and community-based services. And I think it just gets kind of left out sometimes because we don't think of that as that type of service that we all utilize, but every one of us utilizes transportation in some form or manner to be able to do our daily tasks. And to keep that in mind when you're thinking about what needs are for seniors and people with disabilities around transportation needs.
Okay. Thank you, Michelle, for your awesome work that the Transportation Subcommittee has been doing, and the congratulations on getting all of your top priorities in the 2025 initiative plan. We do have time before we open for public comment for other DACLAC members to weigh in with comments or ask questions. So we'll go ahead and take some of those comments now for the next couple of minutes. And it looks like we have, first up, Allison.
Hi there. Thank you. I'm going to just say thank you all for your advocacy and your leadership on this. This is my first introduction to the DACLAC and to all of you in your various hats. I really appreciate the work that you have been doing your entire careers and in your entire lives. It's meaningful and important, and I'm really glad to be a part of it. And I'm really glad to be joining you in this work on top of that. So I started at the State Transportation Agency a little over a month ago. I am learning all of the ropes, and ropes I didn't even know existed. And one of the things I'm really pleased to be doing is working with Michelle in a number of things, because transportation is so critically important to everyone's success, but particularly for those who do not have, who rely on public transportation, who rely on safe streets, sidewalks, bike lanes, those who need to get from place to place. Mobility is critical to everyone's success, particularly in this community. I also wanted to really acknowledge that, we're one of the 3 subcommittees here in the three parts of the stool, if you will. I think there's more, but housing and our home and community-based services are also really important. They don't work unless the other 2 are working, right? And so that's where I really appreciate the work that the entire committee is doing and how we support. As I start getting more into things, I'm happy to continue to work with you all individually or in the committee forums. Please feel free to reach out if there are things that we can put daylight a little bit more of, particularly your individual struggles, individual challenges. I took to heart what Marty was saying about breaking silos down. It's something that I do very intuitively. I am a dot connector and a silo buster, and anything I can do to help with that is really, really important and critical. So, we can do this when we name and see it. And so seeing you all, naming you all, and elevating the need is so important. So I really appreciate that. Again, I'm still learning a little bit of the dynamics and the opportunities, but I really appreciate all of your work, especially at this really, really important and crazy time. So thanks all for giving me a little bit of time.
Thank you, Allison, and thanks for joining us today and your commitment to working with the Transportation Subcommittee and moving some of those priority issues ahead. Next, we have Debbie.
Hi, everybody. Still Debbie Toth with Choice and Aging. Thank you, Sherry. Wow. I'm sitting in awe of Allison. In 1 month, she has learned more than what we've tried to teach Caltrans in 3 decades. So congratulations to us. And thank you to Allison. Yes, Marty, dot connector and silo buster. That's what you have to put in the new award. So yes, learning. There's a lot of learning to be done. And I think that, through Michelle's leadership with Adina's support, because it takes a village to make these things happen. And when we make a commitment, DACLAC committee as a committee to be led by people who are impacted by what it is that we need to have in this state. It's real. You want to lift the voices, and we've seen that in today's meeting. I'm so impressed with the stories. I'm saddened in a lot of ways, but I'm also really heartened that this is now how we're shifting. Like, we are really centering the voices of the people who are either caregivers or who are living this experience, or who are family or friends who love people who are impacted by bad policy and by the invisibility of older adults and people with disabilities. So I really wanted to just broadcast to this group, we need people on the DACLAC Transportation Subcommittee who have lived experience, who are blind, who are deaf, who use wheelchairs, who use power chairs, who have people that they care for with Alzheimer's disease and dementia, people for whom the broken system of paratransit, which the ADA should be the floor and not the ceiling, are, in my opinion, adult abused by this system. So I think it's really, really, really vital. And I want to just, Allison, you said it beautifully. We can't have the other legs of the stool without this leg. Nothing works without being able to get to and from what you need. And so I think that is absolutely vital. And I think we have some, I hate the term low-hanging fruit, but I'm going to use it because everybody understands that vernacular. But I mean, I think we have some really simple things that we can move in a time when we don't have budget money to make sure that we are prioritizing and elevating. I just want to point out one last thing and then I'll be quiet. But when we saw the ARPA funding come in to save transportation during the pandemic, we saw like $43 billion go to transportation, $43 billion, of which 50 million was for elders and people with disabilities. That is the percentage of investment we give to the population that is over 30% between people with disabilities and older adults of our nation. And I think that's the exclamation point that we need to aim to address. And I'm sorry to the interpreter that I speak too quickly.
Thank you, Debbie, for your comments. We're going to move to Nina next. And then after Nina, we have Kimberly. Michelle, if you want to put your contact information, your email address in the chat, you can do that. Or if you're not able to do that quickly, I can certainly do that for you. Just let me know. But we've got Nina coming up next.
Hi, folks, again. So point of clarification, we can make comments about any of the previous subjects, right? It's the subcommittee pieces. So I just want to add a plug for something. And first of all, let me back up. I've already said this in chat, but the speakers today, the program, congratulations to all the co-chairs and everyone who raised their hand to share the lived experiences Debbie noted. This is one of the best presentations I've seen as a member of DACLAC. I do just want to raise up on housing. We need to do more to streamline permitting, land use reform, all remove roadblocks, impediments to the creation of housing that are unnecessary and costly, and add significantly to the many issues we're having with affordable housing. That includes low-income housing, missing middle housing. So I just want to put that plug as well. And obviously we're not here to talk about that, but none of these ideas will really bear fruit if that land use, permitting reform, et cetera, is not enacted. So thank you.
Thank you, Nina. Kimberly.
I just wanted to thank you all for hearing me. I felt really hurt today, and I'm getting lots of direct messages and some resources. So I do appreciate being a part of this committee, and I feel like it's a support group. So thank you for allowing me to cry and bare my soul with everyone, because I feel hopeful. And I love being a part of this, and I love learning about all what's available. And now I'm glad to be in the fight with everybody to ensure that everyone gets the services that they're all entitled to. So thank you all.
Thank you, Kimberly. I'm going to turn it back to you, Michelle, if you have some closing comments before we open it for public comment.
I just want to make sure that we not only put a shout out to Dina Levin's group, Seamless Bay Area, for all their support of me as chair of the transportation subcommittee. Without their help and support, and along with CDS, I would not be able to chair the sub. And I just want everybody to know that they're a huge support for me and the group. And I also want everybody to know and to be thinking about possibly joining the transportation subcommittee, because I'm leaving the DACLAC this fall. So we're looking for a chair and co-chair for the subcommittee. So be thinking of that as an added plus to your advocacy, and for you to join the subcommittee now to possibly get a heads up of what we're doing on our monthly calls. Thank you. And
Great,
if we could,
thank you. Yeah, Adina would like to make a comment. We have time for you to do that, Adina. I did want to point out that Michelle did put her contact information in the chat. Go ahead, Adina.
Yeah, so for people that are interested, the State Transit Transformation Task Force that Michelle had mentioned has an agenda item on accessible transportation at their agenda at their meeting this coming Tuesday. And the agenda was posted in the chat. There are some slides that have been shared with transportation with task force members but are not yet up on the website. If you are interested in that, and there's some really good substantive recommendations that are going to benefit from encouragement and comment and support in order to be able to come out on the other end as recommendations from this task force to the legislature and the administration. If people are interested in listening to that discussion, making comments in person and in writing, and incentive to join the DACLAC Transportation Subcommittee list. I'll be sending an agenda item with some thoughts to that list today or tomorrow. That's going to have a little bit more information about how to comment on that task force. Once again, the task force meeting with the agenda item on accessible transportation is this coming Tuesday. And the inclusion of accessible transportation in the scope of that was thanks to some support and advocacy from community members over time. And that was what I wanted to share.
Great, thank you so much, Adina. It sounds like perfect timing for that, for people to get involved in that task force meeting. Okay, Carol, I think I'm going to turn it back over to you, and we're right on time with opening up for public comments.
Thank you, Sherry. Good afternoon. Thank you very much for staying with us. This is our second public comment period. If our attendees would like to leave a comment, please either raise your hand using your Zoom icon or *9 if you're on the phone. And of course, at any time, you can send a written comment to our Engage email box at engage, E-N-G-A-G-E, at aging.ca.gov. Let's give it a little bit. Had a lot of content today. And let me give you that email address again, and we'll put it in the chat. Anytime you want to send written comments to us, you may do so to our Engage email box, E-N-G-A-G-E at aging.ca.gov.
Thank you, Karen. I did want to remind everyone once again that the public comment can be made on any of the topics that we discussed today. So everything from any of the secretary and director's comments in the beginning to any of the subcommittee presentations. feel free to unmute now and we'll listen to your comments.
Thank you so much. We do have, Debbie has raised her hand. Debbie, I'm going to add your spotlight. Was there something that you wanted to add? Or did you on purpose raise your hand?
I did on purpose raise my hand. I wrote in the chat, I would like to make a comment on something earlier that I wanted to talk about related to the HCBS subcommittee, but I didn't want to do it before public comment if there were public commenters.
Well, let's give it a couple more beats. Not seeing any more comments. I'll go ahead and let you make that call, Sherry, and then we will also turn it over to our director, Susan DeMorris, to close us out. So if you're okay
Yeah,
with that, Sherry?
Absolutely. Let's have Debbie join us.
Thank you. Thanks, Sherry. So I hope we still have some of our amazing department directors and staff. I realize I did not include staff earlier in my commentary about gubernatorial appointees. Also the staff that is filling the Department of Aging, the Department of Healthcare Services, Health and Human Services. I mean, we've seen folks from Justice and Aging, the Alzheimer's Association, independent living centers. I mean, just people who have been out in the wild with that direct touch service. So all of you are our voices behind those closed doors in those rooms where we talk about things, and it feels good to know that you're representing us there. I particularly wanted all of you to hear my commentary here. I think historically, when we pass state budgets, we look at numbers on a piece of paper that are calculated in the context of a year and spending money. It's not the way we do budgeting at home. We actually look 3, 4, 5 years out and look at how our saving money may not happen today because we have to spend it to save it. So I'm just going to walk you through that example. In 2017, we heard from Rebecca Shoup, who was at that time over the long-term care division at Department of Healthcare Services, that the year after we transitioned people out of skilled nursing facilities with our California Community Transitions Project, the first year there's expenses related to the transition, but the second year, when we aren't having the transition expenses included, we were saving $85,000 Medicaid dollars, 85,000, let me repeat that, $85,000 a year in Medicaid savings. So when we do foolish things, and I was thinking when Janie was talking about don't do cuts to IHSS, when we do foolish things because we're trying to score a budget for 1 year and we're not looking at what the full picture is, we will institutionalize people who do not need to be institutionalized. AARP in 2017 did a study of all the Medicaid recipients living in skilled nursing facilities in the state of California and found that 37% of them were low care needs. They did not need to be living in institutions. And if we make cuts because we work on the same, I don't know what to call it, budget methodology, we are going to cost ourselves more money in the long run from a value-based perspective, from a fiscal perspective, and from a humane perspective. Thank you.
Thank you, Debbie.
Debbie.
Okay, Sherry, you want me to close it out?
Yeah, I think we're ready
Okay.
for you, Susan.
All right.
Yes, go ahead.
Well, this is a remarkable group. I can't believe we had so much substance and content, and we're on schedule here. I'm gonna run through a few things. I want to first acknowledge a new member of the California Department of Aging's leadership team. We're joined today for the first time by Anna Acton, who is in our Division of Policy, Research, and Equity. Anna is an assistant director and joins us from the Department of Rehabilitation. Welcome, Anna. I also want to join the chorus of thanking Marty Amoto. Marty, I have learned so much from you over the years, from your powerful, powerful example. You'll be missed, but I'm glad you're a Sacramentan, so I hope to see more of you. I want to thank our leadership of the DACLAC, Sherry, Hagar, Michelle, Marty, incoming chairs, subcommittee chairs. Thank you. You put in a lot of hours, a lot of time between meetings, and we really appreciate it. And it was reflected today in the really strong agenda and substantive work. For those who are still with us, I want to extend my appreciation to our many, many state partners across multiple agencies and departments, and especially thank our Secretary, Kim Johnson, for joining us at the top of the meeting, and my co-chair, Kim Rutledge, at the Department of Rehabilitation. After this meeting, you're all going to learn, this was a theme that really came through for me and many of you on DACLAC and many who participated and contributed at today's meeting. Bring your lived experience. Thank you, thank you, thank you for sharing with the group what's going on in your lives, what your fears are, what your hopes are. We are standing up an Aging and Disability Lived Experience Advisory Board. This will be part of the Master Plan for Aging, and you will all hear about how to self-nominate or nominate an individual. We've made so much progress where we're hearing more directly, as Debbie said, from people who are using services, who are eligible for services, and we can do better. So this ad liab, as we call it, we're recruiting now. So you'll hear about that. And then my final word is, at the outset of this meeting, I don't know how you all do it, but I am inspired. Heading in today, we're talking about federal threats, so much budget uncertainty. We're still reeling from the devastating wildfires in Los Angeles. And yet I'm inspired by all of you. And I just want to thank you so much for contributing to today's meeting, for giving all of us hope, because the road ahead is it's going to be hard. It is already hard, and we need each other. We need to lean into each other. And I really felt very strong in community, and it's incredible when you can be virtual and feel the power of community without being present. So I felt that today. I hope you all did too. And we're going to be counting on you, and we know that you're counting on us. So we'll do this together. And we're in the fight together. So thank you all for being a part of it. Thank you to the CDA team for such a fabulous job leading this 3-hour Zoom meeting. And we close with where you can find the meeting materials. And the 2 remaining meetings for this year are on June 12th and October 9th. Thank you all for joining, and have a great afternoon.